So the next presentation is looking at pain. And it's important to understand that all pain is real pain. It's not in your head. But each person's pain is unique, and you cannot prove that you have pain. And that's always difficult to make other people understand when you are experiencing pain, maybe with activities that they feel that you shouldn't be in pain with. You cannot see the pain. But all pain experiences are a normal response to what your brain thinks is a threat. And that's the important thing to remember. It's about what your brain is interpreting as that threat. It's thinking there is a threat there. There doesn't actually have to be a threat. So real pain can exist without any damage to the actual tissues. So that should be reassuring when you're actually getting out and about and you're doing activities that are causing you pain. Although we don't want to be exacerbating that pain to a level that is not manageable, it's important that you understand that you can do activities that are causing pain because it's not actually causing you harm. Pain is very complex. It's an electrical and chemical response. The nervous system is a complex structure. The brain is a complex structure. And what we want to try and do is allow you to understand that process a little bit in greater detail. And also the intensity of pain is not necessarily related to the severity of the injury. It's again that interpretation of the brain. It's that interpretation of what that threat is. So looking at these pictures, would these be painful? If you were to have all of those piercings, for example, would they be painful? If you were walking across hot coals, would they be painful? Now we know that people have all done these things and they have managed these things. And a little story about a builder who stepped on a nail, trod on a nail, was in absolute agony, ended up needing to go to accident and emergency. In accident and emergency, the doctor wouldn't take off his shoe. They needed to go and x-ray his foot first to see where that nail had gone into his foot. So of course, they were thinking the worst, that this nail, it must have gone into the foot. The patient was in extreme pain. But actually when the x-ray came back, that nail had gone in between the toes. It hadn't touched the foot at all. And that just shows that it was the brain's interpretation of the threat of the nail hurting the foot. And it wasn't actually, an injury at all. It was the interpretation that injury could have occurred. So that's the brain interpreting the threat to the foot. But of course, that patient was experiencing true pain. So how do we explain pain? This is a little video. It's quite good to watch, just to give you a little snapshot again on explaining pain in a simple detail.
Everyone agrees that pain is a universal human experience. We now know that pain is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal things, including work. Or you might have had it for 3 months or more, and this pain is generally called persistent or chronic, because in this type of pain, tissue damage is not the main issue. What's less clear, though, is when you're told you have chronic pain, is knowing what's best to do about it. Well, in Australia, chronic pain is a really big problem. In fact, 1 in 5 people have it. Having a brain that keeps on producing pain, even after the body tissues are restored and out of danger, is no fun. Some people say it still feels like they must have something wrong. But that's just it. Once anything dangerous is ruled out, health professionals can explain that most things in the body are healed, as well as they can be by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the sensitivity of the nervous system. In other words, it's more complex. So to try and figure out what's going on, you need to retrain the brain and nervous system. To do this, it's helpful to look at all the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at persistent pain from a broad perspective, and by using a structured approach and a plan, it's less likely that anything important will be missed. Let's start with the medical side. Firstly, taking medication can help, but only to a limited extent. It is the more active approaches that are necessary to retrain the brain. So using medications to get going is okay, and then mostly they can be tapered and ceased. Some people also think surgery might be the answer, but when it comes to a complex problem like chronic pain, surgery may not be helpful. So if you're thinking of surgery, it's best to get a second opinion, and remember to consider all the things. Next, it is helpful to consider how your thoughts and emotions are affecting your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then there's often enormous value in exploring the deeper meaning of pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed, many people with pain can make useful links between a worrying period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best, and you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain and it can be retrained, and when looked at from a whole person or broad perspective, gives you a lot of opportunities to begin. So, get a helping hand if you need it, set a goal, and begin.
So the video you've just watched has some important messages in there, and it's a lot of information to take in, so it would be important, I think, to revisit that video at a later date. So moving on to what happens with pain, and they're really that flare-ups are normal. You should expect your symptoms to go up and down. It's not going to be on an even keel. And you need to recognise what's happening to you. You know, don't panic. When things are bad, but things have been better, things can be better again. But you do need to modify your activities for a time if necessary. It's important to not oversensitize the nervous system. You can't just plough through it. And it's okay to use pain relief if required. And that's something that we'll be talking about in one of the later presentations. But also it's important to discuss things with your GP. If your pain isn't at a manageable level, there are medications that are available, but it's important it's tailored to you. And it's also important to stay active. So it doesn't matter how much pain you're in, try and do something. It's important to stay active as much as you can. It's true what they say, if you don't use it, you lose it. So what next? There's a few resources that you can access, one being Pain Bites, and another website called Live Well with Pain. There's also a pain class that we run here at the William Harvey Hospital that's available. Again, it may be something that we turn into an online resource. It covers some of the explained pain messages that we've covered in this presentation, but in much greater detail. So just to have a look at a couple of those websites, so looking at Pain Bites. So it has a wealth of resources on here. There's another video that you can watch. It talks a little bit about pain and physical activity, pain feelings, pain, mind and body connection, pain and family, because as we know, your connection with your family and how they understand your condition is important as well. So it's worth having an explore of that one. And the other resource, Live Well with Pain. Again, you need to have a little explore, but there's different resources in there. So resources for patients, it will talk a little bit about goal setting and pacing, which Lisa will talk about later. There's another booklet on explaining pain, a little bit about medication, which again we'll talk about later. So plenty of resources on there that are worth having a look at. And also, the pain clinic are available for people that aren't managing their pain well. It's important that we go through the step-by-step process of looking at the ladder of pain medications, which most of the things can be done either in hospital with us or via your GP. But for those people who are a little bit more complex and need some more guidance on pain medication and looking at other resources to try and manage pain, the pain clinic is available, and that's available via referral from your GP.